almost all of the uninsured come from working families. If you work hard for a living, shouldn't you be able to go to a provider? How are you going to make sure working families can afford coverage, especially since some work for employers who don't offer health care?
We were unable to find a statement from Radcliffe, Representative Radcliffe, to relate to this question. To be completely fair, we wanted to keep Mr. Radcliffe's answers on his public statements alone. So I can't make anything up, or I would.
Commander, did you receive the answer to that question when you talked to him? We said some people believe that it should be free market. If you can afford it, you can buy it.
Well,
that's your choice.
Tom, I plan to talk about that later, but I'm glad to mention that now. I was in Washington, D.C. for a meeting, and on my way home on March the 24th, which happened to be the day that the House of Representatives decided not to vote on health care for the first time. The plane was about an hour late. As I was waiting to board the plane, about 3 representatives from the Texas delegation got in line, and then there were about 6, and then 8, and then 10, and about 15 that I could identify anyway. And I kept thinking, boy, I sure would like to talk with one of them. I got stuck in a window seat, which I don't know about you all, but my preference is not to be stuck in a window seat. The only seat that's worse than a window seat is the middle seat. And sitting in that middle seat was John Radcliffe, with a young priest sitting on the other side. I kind of thought maybe that was providential. I introduced myself as a constituent. John said he was glad to meet me and wanted to know where I was from, and he said, well, Grayson County is one of the most conservative counties in the district, but I don't want to know your affiliation. Okay. So I asked him about healthcare, and I asked him about the tension that I see between someone who may need some kind of care, some kind of health care, and being able to afford access to that care. John's response was to say, well, you know, some people believe it ought to be like retail. I said, what do you mean? He said, well, it's like going to the grocery store. If you want to buy a gallon of milk, or if you want a steak and you don't have the money for it, then you don't get it. That was his response about health care. If you can't afford health care or health insurance, you don't get it. I don't know if that's the underlying principle of many of our Republican representatives, but my suspicion is that at the heart of it, they really look at things so much based on markets that really is their priority. That really is what they think about. If you're poor, if you're on the margins, you're supposed to work harder. If you've got 2 jobs and at minimum wage you can't afford health care, then you need to get a 3rd job. And if a 3rd job won't do it, then you need to get a 4th job. You somehow need to be working all of the time for every hour of the day to be able to make ends meet. That somehow is supposed to be teaching you a lesson, or motivating you, or getting you to advance yourself in some way so that you're making enough money to live in Rowlett or Heath or some other place behind maybe a gated community, or living in a McMansion where healthcare is not an issue. Or maybe, like for most of us, where we are provided with health care through our employers. But here's what happens. I happen to sit on the ethics committee of one of our local hospitals. And I learned through some of our meetings that 37% of their funds are in non-receivable accounts. 37%. That means that hospital is really put on the margins by people who are not able to pay. And what is it that they do? They can't afford health insurance. They can't afford to go to a doctor. They get a sore throat. They get a kidney infection. They have something else go wrong. They fall and break a leg. They get an injury at work. They go to the emergency room. They don't go to the regular kind of health care that we might have access to because we have insurance and are able to go and have it taken care of. They go to the emergency room, which is the most expensive care you can receive. They get taken care of. They are not able to pay for it. And then those of us who do have insurance and go there for care have 37% of the funds that our insurance pays for, and 37% of the deductibles and other things that we pay for when we go there go to cover those unreceivable accounts. That's one of the most inefficient ways you can go about health care. The Affordable Health Care Act, I believe, encourages people to take responsibility for their health care by advocating and pushing and encouraging them to have health insurance. It's about people taking responsibility by having health insurance and by having health insurance that is affordable. And where it's not affordable, there's a small supplement that makes it affordable. That's what the Affordable Care Act is about. And what happened to the Affordable Care Act? We hear Republicans talk again and again and again about how it's crashing all around itself. It's falling down. It's falling to pieces. It's not any good. It was terrible from the start. $2.5 billion was put into the Affordable Care Act as a way of providing insurance companies with money to help them establish the markets and move from what they have been doing into the Affordable Care Act to take care of the people who were not able to afford access through their policies. Senator Rubio in 2015 put an amendment into the budget which cut the $2.5 billion down to $700 million that was already promised to insurance companies. They had put their markets into place relying on the plan that Congress provided for them, that they would receive those funds in order to get the markets established and get up and running. When you take money away from the companies that has been promised to them in order to participate in the program, then what do you expect is going to happen? The markets are going to be more expensive. Companies are going to pull out. They're not going to participate because it's a losing venture. It's not that the Affordable Care Act was poorly designed, but when you intentionally sabotage it by taking money out of it, then, surprise of surprise, it might not work quite so well, which is exactly what's happening now, thanks to our Republican representatives and senators. We live on a principle of caring for people. I do not believe we will do the kinds of things that Representative Radcliffe has said. We will not leave people at the door of the hospital and say, you may not be admitted because you do not have an insurance card. You do not have a policy. We will not leave people on the street to suffer because they are injured or because they are ill. That's not who we are. We are better people than that. We believe in caring for people who are suffering. how we've gone about doing it is not a very efficient way. The Affordable Care Act was a way of putting in place care for people who are sick or injured or in need of care. That's what we're about. That's who we are as Americans, not just Democrats. That's who we are as a people.
Mr. Bethel, I would like for you to replace Mr. Ratcliffe as my representative.